Hello, everyone. I am your host, Dr. Enrico Dolcecore, and thanks for joining us on another episode of Living a Full Life. Last week's episode about regulating the nervous system was great. I thought it was just another normal episode. And then the messages started coming in about wait a minute, how does chiropractic play a role? We gave so many examples about deep breathing, Tai Chi, exercise, proper sleep, but the questions that were coming in through email were, wait a minute, how does chiropractic play a role in this? So I thought, hey, here we go. Part two on how to regulate your nervous system for all those great benefits that we talked about. Regulating your nervous system is just a fancy way of saying adapting to the stresses of everyday life. And what happens is when we get overwhelmed, whether it's conscious or subconscious, it dysregulates our nervous system. We become more sympathetic. We can even become more parasympathetic, but most people become more sympathetic. We're externally driven. We're over caffeinated. And then that cyclone that I talked about, that spin, the negative feedback loop that starts to happen where we start to lose a little bit of sleep. We start to get a little bit more fatigued. Our cortisol starts to go up. Our hormones start to cascade. And then just all these negative things start to pile up, and then we get more fatigued, and then we get chronic fatigue, and then we get joint pain, body pain, muscle pain, and it just starts, and it almost feels like, and then everyone comes in and says, I'm getting old. Well, no, pump the brakes for a second. I know 70 something year olds and 80 something year olds that have no discomfort. There's no that doesn't have to be a linear thing. And it's all about nervous system regulation. So let's dive into chiropractic. Chiropractic's over 100 years old. It hasn't changed much. The equipment's got a lot fancier. But when you go to a chiropractor, they got one tool, well, two, their hands. That's really it. And it's been an art for over 100 years, 130 years. And it's been doing the one thing. I'm going to tell you the principle that's over 100 years old that still stands today. And these are 5 ways that chiropractic helps with with regulating the nervous system. And one is the alignment of the spine. The adjustments aim to correct misalignments or subluxations in the spine, which may impinge on nerves and disrupt the flow of nerve impulses. This has been the old time thinking. It's written in the green books. It's written in the first curriculums in chiropractic school over 100 years ago. And it says that when the spine goes out of alignment, it directly puts pressure on a nerve. By restoring the proper alignment through adjustments, chiropractic care may help alleviate nerve compression and improve nervous system function. Up till today, 2024, it is still in the literature that chiropractic adjustments can or may improve nervous system function. They can, and they do. The optimists say they do, and the naysayers say maybe. That's fine. We'll take the maybe. But the truth is that by getting adjustments and aligning the spine, the nervous system regulates better. We've documented it with many different tests, and it's all over publications for 100 years plus. So it's there. But the old kind of cartoon analogy of like a bone goes out of place and directly puts a physical pressure on a nerve isn't exactly correct. There's much more that goes on to it, and it's very rarely a physical force like a joint going out of alignment. That's not, your body doesn't move like that. Your joints are in place, locked in with ligaments, cartilage, synovial fluid, synovial joint, synovial membrane. I mean, there's a huge dynamic that comes to every joint in your body. It's not moving. It's not going to shift left from right too much. I mean, with a millimeter or two, maybe some movement, which can cause pain and discomfort, but we're not having these massive shifts where our hip goes out of socket or anything like that. That doesn't happen. So the whole cartoon, and now I remember sitting through, the first year of chiropractic school, I'm thinking in my head, oh man, if the vertebra slides right out of place, yeah, that'll put pressure on the nerve. But that's not how it works. When our joints go out of alignment, they twist, and we're 3D, right? 4D. And when we go in different directions and we twist and pull, all the soft tissue has to twist and pull with it as well. So then you get this pulling effect or neural tension where nerves may not be directly pinched, but they will be pulled or stretched, almost like elastic bands. When you get an elastic band and you don't put any stretch in it, the first little stretch that you do is really easy. It moves really easy. But once you need to stretch it more to get around a bunch of envelopes or a bunch around a paper or pens, you can see how much more tense the elastic band gets. If you pull it enough, you can break the elastic band. That's how our soft tissue works. It works, and it only has a certain range that it can go. So, and it will take other things with it. Enough on misalignments of the spine, but those are subluxations. Dislocations of any joint are complete dislocation. It means that they're no longer located in the position that they're supposed to be, and they're now dislocated. That's completely different. Minor movement of joints out of alignment is a subluxation. It can happen anywhere in the body. It can happen in your big toe, it can happen in your ankle, it can happen in your elbow, and it most definitely can happen in all the hundreds of joints in your spine. So that's it. And that's the biggest way chiropractors help. The second thing is pain. I mean, this is the number one reason why people seek chiropractic care, and chiropractic adjustments can reduce pain. They do reduce pain. Spinal misalignments and nerve compression contribute to pain. Chiropractic adjustments have been shown to help reduce pain by relieving pressure on nerves, muscles, and other soft tissues. And the relief can lead to decrease in stress and tension within the nervous system. Of course, pain causes tension in the nervous system. And by adjusting the spine and getting rid of the pain or diminishing pain, you diminish the tension on the nervous system. You put people from sympathetic back to homeostasis. Very cool. And we actually measure that in our office on everyone, which is very cool. We talked about heart rate variability in the last podcast. You may want to go back and listen to that one and this one. They're both pretty short, but well worth the listen. Number 3, improvement in communication. Kind of goes in hand with misalignment, but the nervous system relies on clear communication between the brain and the rest of the body to coordinate all the functions and maintain overall health. So chiropractic adjustments may facilitate better communication within the nervous system by removing interference caused by spinal misalignments. That makes sense too. It's all going to come back to the same thing. Removing misalignments from the spine improves function. Removing misalignments from the nervous system improves function. Removing misalignments from any joint in the body reduces pain and improves function. And once we improve function, we decrease tension, and decreased tension decreases increases nervous system regulation. The positive feedback loop. Chiropractic is the key in stopping negative feedback loops right in their track with a hard stop, and then reversing, putting it in reverse. I don't know if you're old enough to remember VHS players. If you got to a part in a movie and you had to go back, you missed and you had to go back, you had to hit the rewind button. You literally had to hit pause or stop and then rewind. And this thing would rewind and you would see the movie in going backwards. And you could hit play and try and time it right in time and stop it so that you could go back and catch the last scene that you may have missed. Or maybe you wanted to watch it again. Now you have a remote that just goes back. And if you wanted to go back to the beginning of the movie, oh my gosh, well, go hit rewind, come back in 20 minutes, go grab a coffee, and the movie would be rewind. So that is what chiropractic does. It's that stop button. Boom, stops the negative feedback loop. And once you work more on your system, because I'm just going to use our example. I shouldn't speak for the whole industry because there's many different types of what chiropractors do, and they can pick and choose what they do. They may just want to adjust people. Other people may want to do a bunch of sports injury stuff with lasers and all that. So that's great. Some don't even touch people. They just do functional nutrition. They just do nutrition because they believe that, food is the medicine. But anyways, in our office, once we get the positive feedback loop going, we then tie in supplements, nutrition. We even look at blood work. We look at IV therapy, whatever we need to do to facilitate a positive feedback loop to start getting this spinning like a cyclone in a good way. And that is the amazing stuff that happens. And that's why you can see that this is probably the most excited I've ever been on a podcast. Then number 4, enhancement of blood flow and healing. The things that we don't see behind the scenes, that's where all the credit goes for everything. The person on stage is never the person that gets the reward. It's the people behind the scenes that create the show or whatever it is that should deserve most of the credit. Same thing here. Enhancing of blood flow and healing happens when we get adjusted. It may improve. You can see I'm using evidence-based literature here. May improve. It does improve. We've showed it. It does improve blood flow to the spinal cord and surrounding tissues, which do support the body's natural healing process. Enhanced circulation can also contribute to improved nervous system function. Okay. How many more? You need more? I got more for you. If you need more proof, let's keep going. And of course, we talked about this cycle. Once you break the negative feedback loop, you reduce stress. So chiropractic adjustments can reduce stress. The chronic stress can have a significant impact on our nervous system over time, and even in a short matter of time, leading to increased tension and dysregulation. In chiropractic, we call this dysautonomia. Dysautonomia. Your nervous system is your autonomic nervous system, ANS, the autonomic nervous system, right? That's where it comes from. When the autonomic nervous system works well, it's just called autonomic regulation. When it's not working well, it's called dysautonomic regulation or dysautonomia, dysregulation of the nervous system. So we've actually named these things and dug deeper and dive deeper in the literature and in the science to explain what is happening. And you get this disaffrontation and dysautonomia of the nervous system, which works like an internet superhighway. I don't know if you've been to Los Angeles with the 8 lanes going north and the 8 lanes going south. Have you seen those 16-lane highways? Unbelievable. Your nervous system has 1600 going north, 1600 going south. Like you can't even wrap your head around that, what that would even look like landmass wise, but that's how much information can go back and forth per millisecond. And when we interrupt the bottleneck, anything, we start to get interference in the nervous system, which may indirectly cause issues. But chiropractic adjustments, this says, may indirectly benefit the nervous system. It directly benefits the nervous system. How cool is that? Right? People experience positive outcomes from chiropractic every single time, every single day they come into the office. And sometimes it's small. So sometimes it's small impacts. Like they're in a lot of pain and they just only have a little bit more comfort in the first week and they just feel a little bit more comfortable, but they're still in pain. So they want to get at their goals to get out of pain. So even though they can now get in and out of the car a little bit easier, it doesn't seem like a huge win. But these are the things we use to progress, get people out of pain, get them functioning better, and then not letting them leave just because of pain, but to try and get this positive feedback loop going so that they can be as healthy as possible. That is the benefit of chiropractic. So we talked about in the last episode, deep breathing exercises to help. Yoga can help. Tai Chi, martial arts can help. Sleep is the absolute best thing you can do. And folks, I mean, you don't have to pay anyone. You don't have to do anything. I mean, sleep, everyone has to do it and try and stay up. I mean, you're going to fall asleep at some point. At some point today or tomorrow, you're going to fall asleep. You can't stay up forever. So improving our sleep is the biggest impact you can do right now. Then the next thing to do is seek out tonal chiropractors, functional neuro chiropractors, people a little bit more focused on tonicity in the nervous system, because the way they adjust is going to be a little bit different than the pain and rehab clinics that are in there to just manipulate joints as much as possible to get as much range of motion to get you out of pain as fast as possible. And there's nothing wrong with that. Some days I'm sweating. I'm on there and I'm getting people to move because they need it. And then most of my days are gentle click, the activator or the torque integrator, and using little techniques or strictly upper cervical work where we don't even really touch the patient, just their upper neck a little bit, table drops, whatever the patient needs, we do whatever they need, honestly. And if we can't do it, we refer them to people that can. So look that stuff out and keep these questions. How fun is this? The questions come in. Obviously, some people listen to the podcast. That was great. And that was a fast turnaround. We just released it last week. We had the questions, and I was like, great. I have now a podcast topic to talk about. How about nervous system regulation through chiropractic care? That is very cool. So no matter where you're listening, look it up. And you know what? Just send me a question about that. I love putting in zip codes and postal codes and looking up chiropractors in the area. And then I get to mix and mingle with them and send questions to them. Be like, hey, do you know anyone in the area that does tonal chiropractic? And typically half of the time the chiro responds back like, I do torque release technique. I do activate. I do tonal. I do craniosacral. I'm like, perfect. There's the perfect referral. And then I message you back. I'm like, hey, right there in Kirkland, Washington, right there. You got yourself a tonal chiropractor or an upper cervical, whatever it is. So I love doing it too, but you can look this stuff up on your own. Great. And send the questions coming. Have a great week. Stay healthy, stay well, and take care.